Hi everyone, Shan Orthopedics here. This is going to be a continuation of my knee osteoarthritis series where I'll try to explain to you further on the different types of approach used to do a knee replacement surgery. Touch a bit on the robotic aspect of this. Now you can also have subtitles in Bahasa, in Tamil, also in Chinese. Just click the captions option available. Now traditionally, like I said in my previous video, most of the doctors will tell you that after the surgeries your knee will be straight, and of course they'll also tell you to limit certain activities. Now this defeats the purpose of the knee surgery because now we're trying to force your knee to accept a position that it was not used to. Remember what I said before, only a few subset of the patients have their knee straight, a few subset have their knee outwards, but majority have their knee slightly bent inwards, which is actually common in the Asian population. Now it is very difficult to achieve this with the conventional method, which is why most of the surgeons in the past they go and keep the knee straight. So of course the thinking or the thought process has evolved from that. So initially the aim was to have the knee straight, and then comes in which is called as the mechanical alignment, and then comes in the adjusted mechanical alignment where they do certain cuts to keep the knee slightly bent inwards, but not exactly what is common or what is native to the patients. Later on, we have a new concept, a more personalized concept, which is called as the kinematic alignment. Now to do kinematic alignment, it can be done through the conventional method, but you need specialized jigs which are not routinely available, thereby not many centers are doing it. And though many centers claim to be doing a kinematic surgeries, they are doing somewhat of a hybrid surgery, which is a mix of a mechanical and somewhat kinematic approach. Now with the advancement in the surgery, we have robots that can actually do a precise cuts according to what we want, and not only that we can control the body cuts, we can also assess the ligament tension, and this is where functional ligaments comes in. And functional ligaments is one approach that I feel will definitely be somewhat useful to the patient, because now we use the native ligament tension to dictate how the knee is supposed to be, and thereby giving you a very much satisfied outcome. There's something called as a forgotten knee score, where after the surgery you have forgotten that you have a replaced knee because the knee feels like it is normal. So this is one of the measurements that tells you that functional alignment is the way to go, and this can only be achieved through assisted surgeries using either robots or certain navigations. So I do hope that this series helps you to understand about knee arthritis and how robot surgery will help you to get the best outcome. I hope to see you in the next one. Do stay safe and take care.